associated with cardiovascular disease as well as diabetes. Moreover, doctor, the parent therapy in diabetes, that is metformin, itself causes the deficiency of B12. Doctor, together all this leads to microvascular complications and macrovascular complications. Microvascular complications such as neuropathy, retinopathy and nephropathy, whereas macrovascular complications such as cardiovascular disease, stroke, foot ulcers, gangrene and even amputation. Therefore, doctor, recharge the neuron with Mylonerv D, a must for every patient of diabetes and CVD. Dr. Mylonerv D is a complete formula which contains methylcobalamin 1500 micrograms, alpha lipoic acid 200 milligram, pyridoxine 3 milligram, biotin 200 microgram, folic acid 1.5 milligram and vitamin D3 1000 international units. Doctor, we have methylcobalamin and folic acid which act in the synergy, and you can see, doctor, there is a 38.5% reduction in the level of homocysteine when methylcobalamin and folic acid are used in combination. We also have biotin, doctor, which is not there with many of the available brands of this combination. Biotin increases the proportion of beta cells as well as alpha cells in the pancreas. Thus, doctor, it is definitely useful for the patients of diabetes. Doctor, it contains alpha lipoic acid which reduces pins and needle sensation, which is the characteristic sensation in neuropathic patients. Dr. Mylonerv D has pyridoxine which regulates the insulin synthesis and prevents the diabetic neuropathy as well as retinopathy. Doctor, the most important feature of Mylonerv D that it is fortified with vitamin D3. And doctor, vitamin D3 in Mylonerv D reduces the risk of diabetes. It decreases the insulin resistance in diabetes. It reduces the risk of cardiovascular disease, and supplementation with vitamin D3 increases the survival rate in patients with cardiac disorders. Dr. Mylonerv D is available as a monocarton and it is packed in a beautiful alu packing. So doctor, the shelf life of the product is high and the efficacy of methylcobalamin and all these ingredients remains intact till the tablet reaches to the patient. Moreover, doctor, I would also like to highlight the formula of Mylonerv D with the competitor brands. If you see, the competitor brand has got 100 milligram of alpha lipoic acid, whereas we have got 200 milligram of alpha lipoic acid. And doctor, in the other brand, biotin is not present at all, whereas we have biotin 200 milligram micrograms, which, as I highlighted in the last page also, that biotin is very important and it increases the alpha cell mass and beta cell mass. Thus, doctor, a very useful formula to recharge the neuron of the patient. Please prescribe Mylonerv D, which is a must for every patient of diabetes and CVD. May I look forward for your valuable prescription support for Mylonerv D, sir?